Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the clinical use of chloroquine? Answer: malaria caused by Plasmodium sp. other than Plasmodium falciparum. Question: what is the clinical use of Sildenafil? Answer: cytomegalovirus retinitis in immunocompromised patients. Question: what is the clinical use of dicosanol? Answer: recurrent herpes labialis. Question: what is the clinical use of echinocandin antifungals? Answer: invasive aspergillosis, Candida spp. Question: what is the clinical use of famiclover? Answer: herpes zoster infection. Question: what is the clinical use of febuxostat? Answer: chronic gout, or prevention. Question: what is the clinical use of phenaldipam? Answer: hypertensive emergency. Question: what is the clinical use of flumazenil? Answer: management of benzo overdose. Question: what is the clinical use of fluoroquinolone antibiotics? Answer: gram-negative rods of urinary and gastrointestinal tracts, including Pseudomonas, Neisseria. Question: what is the clinical use of foscarnet? Answer: cytomegalovirus, herpes simplex viruses and varicella zoster virus infections where ganciclovir or acyclovir fails. Question: what is the clinical use of furosemide? Answer: edematous states, hypercalcemia, hypertension. Question: what is the clinical use of ganciclovir? Answer: cytomegalovirus infection. Question: what is the clinical use of gemfibrozil? Answer: TX of type 3 hyperlipoproteinemia. Question: what is the clinical use of abutolide? Answer: acute atrial flutter or AFib. Question: what is the clinical use of IFN beta? Answer: multiple sclerosis. Question: what is the clinical use of IFN gamma? Answer: chronic granulomatous disease. Question: what is the clinical use of imiquimod? Answer: genital and perianal warts. Question: what is the clinical use of irinotecan? Answer: colon cancer. Question: what is the clinical use of laxatives? Answer: constipation. Question: what is the clinical use of lisdexamfetamine? Answer: TX of ADHD in adults and children. Question: what is the clinical use of magnesium ion as an antiarrhythmic? Answer: torsade de pointe, digoxin toxicity. Question: what is the clinical use of mannitol? Answer: TX of ICP and IOP, drug overdose. Question: what is the clinical use of mecasermin? Answer: Laron dwarfism. Question: what is the clinical use of methadone? Answer: TX of opioid abuse. Question: what is the clinical use of methylphenidate? Answer: TX of ADHD in adults and children, some forms of narcolepsy. Question: what is the clinical use of metronidazole? Answer: anaerobes, enteric infections. Question: what is the clinical use of monobactoms, Astrianam? Answer: gram-negative rods only. Question: what is the clinical use of naloxone? Answer: opioid overdose, respiratory depression due to opioids. Question: what is the clinical use of naltrexone? Answer: TX of ethanol dependence. Question: what is the clinical use of nitroprusside? Answer: hypertensive emergency. Question: what is the clinical use of omalizumab? Answer: allergic asthma that is resistant to inhaled steroids and long-acting beta-2 agonists. Question: what is the clinical use of Osoltomavir? Answer: influenza A, influenza B, H1N1 and H5N1 infection. Question: what is the clinical use of Palavisumab? Answer: prophylaxis and treatment of RSV infection in high-risk neonates and children. Question: what is the clinical use of penciclovir? Answer: recurrent herpes labialis. Question: what is the clinical use of phenytoin? Answer: digitalis-induced arrhythmias. Question: what is the clinical use of procainamide? Answer: TX of the arrhythmias associated with Wolff-Parkinson-White syndrome. Question: what is the clinical use of proguanil? Answer: prophylaxis of chloroquine-resistant malaria. Question: what is the clinical use of raloxifene? Answer: prevention of osteoporosis via estrogen agonism at bone. Question: what is the clinical use of tamoxifen? Answer: breast cancer via estrogen receptor antagonism at the breasts. Question: what is the clinical use of terbinafine? Answer: dermatophytoses, especially onychomycosis. Question: what is the clinical use of the monoclonal antibody abciximab? Answer: prevention of ischemic complications in patients undergoing percutaneous coronary intervention. Question: what is the clinical use of the monoclonal antibody adalimumab? Answer, IBD, rheumatoid arthritis, ankylosing spondylitis, psoriasis, via TNF-alpha. Question, what is the clinical use of the monoclonal antibody alemtuzumab? Answer, chronic lymphocytic leukemia via CD52. Question, what is the clinical use of the monoclonal antibody bevacizumab? Answer, colorectal cancer, renal cell carcinoma, via VEGF. Question, what is the clinical use of the monoclonal antibody cetuximab? Answer, stage 4 colorectal cancer, head and neck cancer, via EGFR. Question, what is the clinical use of the monoclonal antibody denosumab? Answer, osteoporosis, inhibits osteoclast maturation via Roncal. Question, what is the clinical use of the monoclonal antibody digoxin immune Fab? Answer, antidote for digitoxin toxicity. Question, what is the clinical use of the monoclonal antibody infliximab? Answer, IBD, rheumatoid arthritis, ankylosing spondylitis, psoriasis, via TNF-alpha. Question, what is the clinical use of the monoclonal antibody natalizumab? Answer, multiple sclerosis, Crohn's disease, via alpha-4 integrin. Question, what is the clinical use of the monoclonal antibody omalizumab? Answer, allergic asthma, prevents IgE binding to FcERI. Question, what is the clinical use of the monoclonal antibody Palavisumab? Answer, prophylaxis in RSV high-risk infants, via RSVF protein. Question, what is the clinical use of the monoclonal antibody rituximab? Answer, B-cell non-Hodgkin lymphoma, rheumatoid arthritis, idiopathic thrombocytopenia purpura, via CD20. Question, what is the clinical use of the monoclonal antibody trastuzumab? Answer, breast cancer, gastric cancer via HER2/neu. Question, what is the clinical use of trifluridine? Answer, HSV keratitis and conjunctivitis. Question, what is the clinical use of vancomycin? Answer, gram-positive only, multidrug resistant organisms, MRSA, enterococci, Clostridium difficile. Question, what is the clinical use of Venerafenib? Answer, metastatic melanoma. Question, what is the clinical use of Xenamavir and Osoltomovir? Answer, treatment and prevention of influenza A and B. Question, what is the clinical, dermatological use of clindamycin? Answer, acne vulgaris. Question, what is the central nervous system toxicity of antipsychotics? Answer, Parkinson-like syndrome, tardive dyskinesia. Question, what is the central nervous system toxicity of bupropion? Answer, seizures. Question, what is the central nervous system toxicity of enflurane? Answer, seizures. Question, what is the central nervous system toxicity of imipenem cilastatin? Answer, seizures. Question, what is the central nervous system toxicity of tramadol? Answer, seizures. Question, what is the combination cancer chemotherapy ABVD used to treat? Answer, Hodgkin's lymphoma. Question, what is the combination cancer chemotherapy BEP used to treat? Answer, testicular cancer. Question, what is the combination cancer chemotherapy CHOP used to treat? Answer, non-Hodgkin's lymphoma. Question, what is the combination cancer chemotherapy CMF used to treat? Answer, breast cancer. Question, what is the combination cancer chemotherapy CP used to treat? Answer, ovarian cancer. Question, what is the combination cancer chemotherapy FOLFOX used to treat? Answer, colorectal cancer. Question, what is the combination cancer chemotherapy MOPP used to treat? Answer, Hodgkin's lymphoma. Question, what is the combination cancer chemotherapy PVB used to treat? Answer, testicular cancer. Question, what is the common ROA for insulin preparations? Answer, SC. Question, what is the common suffix for ACE inhibitors? Answer, pril, for example captopril. Question, what is the common suffix for ACHE inhibitors? Answer, stigmine, for example neostigmine. Question, what is the common suffix for alpha-1 adrenergic antagonists? Answer, zacin, for example prazosin. Question, what is the common suffix for angiotensin II receptor blockers? Answer, sartan, for example losartan. Question, what is the common suffix for antiparasitics antihelminthics? Answer, bendazole, for example mebendazole. Question, what is the common suffix for bacterial peptidoglycan synthesis inhibitors? Answer, psilin, for example penicillin. Question, What is the common suffix for bacterial protein synthesis inhibitors? Answer, cyclin, for example tetracycline. Question, what is the common suffix for barbiturates? Answer, barbital, for example phenobarbital. Question, what is the common suffix for benzodiazepines? Answer, zepam, zolum, for example diazepam, midazolam. Question, what is the common suffix for beta-2 adrenergic agonists? Answer, butyrol, for example albuterol. Question, what is the common suffix for beta blockers? Answer, olol, for example propanolol. Question, what is the common suffix for bisphosphonates? Answer, dronate, for example pamidronate. Question, what is the common suffix for chimeric monoclonal antibodies? Answer, Xenamavir, for example Basiliximab. Question, what is the common suffix for cholinergic agonists? Answer, chol, for example bethanechol. Question, what is the common suffix for dihydropyridine calcium channel blockers? Answer, dipine, for example amlodipine. Question, what is the common suffix for ergosterol synthesis inhibitors? Answer, azole, for example ketoconazole. Question, what is the common suffix for histidine receptor antagonists? Answer, hidine, for example cimetidine. Question, what is the common suffix for HMG-CoA reductase inhibitors? Answer, statin, for example atorvastatin. Question, what is the common suffix for humanized monoclonal antibodies? Answer, zumab, for example tocilizumab. Question, what is the common suffix for inhalational general anesthetics? Answer, un, for example halothane. Question, what is the common suffix for local anesthetics? Answer, caine, for example lidocaine. Question, what is the common suffix for macrolide antibiotics? Answer, thromycin, for example azithromycin. Question, what is the common suffix for non-depolarizing paralytics? Answer, curium, coronium, for example etricurium. Question, what is the common suffix for parade 5 inhibitors? Answer, afil, for example sildenafil. Question, what is the common suffix for pituitary hormones? Answer, tropin. Question, what is the common suffix for PPA or gamma activators, known as anti-diabetics? Answer, gliazone, for example rosiglitazone. Question, what is the common suffix for prostaglandin analogs? Answer, prost, for example latanoprost. Question, what is the common suffix for proton pump inhibitors? Answer, prosol, for example omeprazole. Question, what is the common suffix for SSRIs? Answer, etine, for example fluoxetine. Question, what is the common suffix for TCAs? Answer, ipramine, triptyline, for example imipramine, amitriptyline. Question, what is the common suffix for typical antipsychotics? Answer, tazine, for example thioridazine. Question, what is the common suffix for viral DNA polymerase inhibitors? Answer, over, for example acyclovir. Question, what is the common suffix for viral neuraminidase inhibitors? Answer, iver, for example Osoltomavir. Question, what is the common suffix for viral protease inhibitors? Answer, naver, for example ritonavir. Question, what is the connective tissue toxicity of glucocorticoids? Answer, fat redistribution. Question, what is the connective tissue toxicity of protease inhibitors? Answer, fat redistribution.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.